Hello, everybody. My name is Amber Porter, and I am your childbirth educator. I am going to talk to you today about picking out your birth team or your place of birth. I chose this topic because I feel like it's very important that if you are expecting or if you're planning to have a baby here in the near future, it's good to know what kind of provider that you want, what kind of birthplace do you want to have your baby at, and who your birth team will be. And so those are the things that in this module we are going to go over. Choosing your provider. When you're choosing your provider, your birth team, and birthplace, this is the most important decision that you can make prenatally, okay? It's very important that you pick someone that is going to be able to work really well with you and your partner when it's time for you to have your baby. Birth is an intimate and it is vulnerable. So the choices that you make now will impact your birth experience. So it's very important that if you're feeling uncomfortable or unsafe, it can disrupt the birth process. Know your options at the hospital, your birth center, or home birth. Do you prefer a midwife or do you prefer an obstetrician? Does your insurance cover? And then what role does your insurance play when it comes to your obstetrician or midwife? Now we're going to talk about different providers to consider. What matters most to you? And when I say what matters most to you, try to envision the type of labor and delivery that you want to have. Try to envision the type of pregnancy experience that you'd like to have. And what are your values? And how do they match the provider that you choose's values? So try to consider those things if they're important to you. So, what matters most to you? Find a provider who's aligned with your birthing values for a better chance of a positive birth experience. If you decide to choose your provider and you'd like to know what type of providers are available for you to that deliver babies and also provide prenatal care, there are midwives, there are certified nurse midwives, and there are direct entry midwives. And then you have physicians. You have your family practice physician, and then you have your obstetricians and gynecologists. Now let's talk about different models of care because this is what is going to be the most important uh, aspect to when you're choosing the provider that is best for you, your partner, and your child that's about to be born. You need to know what models of care work because these models of care are going to be different situations, being stuck in different situations, so that not really stuck, that's a bad term to use, but you'll be in different situations. So consider what do you want available for you when you're in that labor and delivery room, or when you are going to a doctor's, or should I say a prenatal visit. What kind of stuff do you want to have available to you? So let's talk about the medical model of care. A medical model of care is more focused on the medical aspects. It talks about the risks. You're going to learn all the different illnesses. You're going to learn all the diseases. And then they're going to talk about ways to manage those risks, manage those illnesses, and manage those diseases. And then they're going to place a high respect on medication and technology. And it's more likely to take charge and have set plans. So if you want a medical model of care and that's the area that you feel safe, well, then it's going to be a little bit more difficult to have a voice, but it's good to have available because you never know, just in case an emergency, they're there for you and they have everything that they need, medicine, technology, and all that good stuff. So that is one model of care. And let's talk about another model of care. A patient-centered model of care. A patient-centered model of care is more likely to treat holistically. So if you are someone who is very organic, you don't like to take a lot of medication, you don't want a lot of medication transferred to your baby, this is where you take that time to say, hey, I think I like a more patient-centered model of care. And that's the kind of care provider that I want. If I choose a midwife or obstetrician or a family medical doctor, then at least you know the model of care that you desire. If you're looking for something holistically, if you anticipate potential issues without acting until it's necessary. Sometimes in a medical model of care, if an issue arises, they just act quickly. But if you're in a patient centered model of care, they want to do what's best and what's more comfortable for the patient. So if there's a way to avoid doing anything quickly, until it's necessary. We're not saying that they're not going to do it, but just until it's necessary, they're going to try to do different things, put you in different positions, try different things to try to make it comfortable before they consider doing anything um, unnecessary just in case. View birth as a social and a transformative event. In a patient-centered model of care, it's more like it knows your body knows what to do. That when it's time for you to have your baby, they know that this is a special time, but your body knows what to do. So when you have that patient-centered approach, again, this puts and empowers you back into your hands. So it's letting you know that you can be confident in your body and confident in what your body will do and that they support that. And then in a patient-centered model of care, more than likely, they will educate and support you with shared decision making. So they want what's best for the patient. You are the patient, and this is where they'll take the time to listen to you, your desires, and try their best to do what you desire. So let's talk about some different types of providers, okay? In the medical model of care versus the patient-centered model of care, any provider can subscribe to either model or somewhere in between. So never assume that a provider's philosophy without asking insightful questions. So don't just go into a doctor's office and assume, okay, they look really nice. That's the doctor that or midwife that you want. You may find out that they're really quiet. They don't speak very much and you might be very social. It's just good to sit down and find out what their philosophies are, get a feeling of their personality, and make sure that you ask questions. Pick some good questions. Maybe even some of the questions that we talk about today. You could sit there and write them down, watch the video over again. Just make sure that you have a good list of insightful questions because you can never ask too many questions. No question is a dumb question. This is your baby, this is your body, and it's your decision as to what you feel is best for your prenatal journey, your labor and delivery, and your postpartum journey because these providers will be with you through those 3 phases. So when you are starting to look into your providers, you want to interview several different providers. Take the time to recognize red flags. It's very important that you know your rights, know your options, know what's available, and what are your individual needs. And then take the time to ask yourself some of these questions. What does your intuition say about what support you need? Who have your friends and relatives chosen to support their births? And do they enjoy them? How have you been treated by care providers in the past? So if you have had previous children before the pregnancy that you're currently in or planning to have, did you have a good experience with your care provider? that gave birth to your child. I'm sorry, that not gave birth to your child, the care provider that um, you used to help deliver your child when you birthed your child, is what I was trying to say. Were they helpful? Did they make you feel safe? Did they answer all the questions that you needed? How did they make you feel? So think about that. What qualities are important to you in a care provider? And does your care provider offer evidence based care with an individualized approach? Our next topic is birthplaces. We're going to talk about some birthplaces here. Healthy, low risk people can choose from various settings. They could choose a hospital, they could choose the birth center, or they can have a home birth. Their options may be influenced by preference, insurance availability, or local regulations. Let's talk about the hospital. At the hospital, they have doctors and sometimes they have midwives. The hospital, they have access to IV pain medicines. They have epidurals um, if you don't want to have if you don't want to feel pain when you're in labor. They have cesarean births and they have interventions. So if you are afraid that you might not have a successful labor, then I would say the hospital is a good place to pick because they do have medical interventions available for you. The hospital may have a NICU, and that is for babies who are having an emergency. And it's the best choice to go if you are a high risk pregnancy, but it's also appropriate for low risk too, as well, especially if it gives you more peace and it calms any anxiety to have a hospital and be at a hospital, then I say choose a hospital. Okay, and now we're going to talk about a birth center. So at a birth center, as you can see in this picture, you notice that the birth center, it looks like a house. It is an out of hospital option. It's usually ran by a midwife, and it has a home like setting for people who may not want to birth in their own home but want to feel at home. They're good, and it's a great middle option that's appropriate for low risk people. And they also have access to birth equipment. So if you want to have a place that makes you feel comfortable, that you feel like you're at home but you're not at home, you could still go to a birth center and you could go home not a couple hours after your baby is born. You can have your baby there, rest for a couple hours, and then you're back home in the comfort of your own bed, and your house is clean, and you don't have to worry about cleaning up any afterbirth. So think about all that when it comes to choosing a birth center. And then you have your home birth. And your home birth, it happens in your own home. You're typically attended by a midwife. Birth equipment is usually brought and available if you need it, and it's appropriate for a healthy, low risk pregnancy. For home birth, you can have your whole family there if you want to, if that's what you desire. A home birth is good if you have a lot of anxiety when it comes to going to a hospital, and so is a birth center. A birth center is another great place for that. If you have a lot of anxiety going to a hospital or going to even a birth center, and you're comfortable at home and you are low risk, then home is a great place to consider having your baby because it makes a huge difference when you are in labor, when you are completely comfortable with your surroundings. It makes a big difference. So you have to consider that when you're thinking about a place that you're going to have your baby. And last but not least, the most important thing is your birth team. And when we talk about your birth team, we're talking about everyone around you that's going to play a role to help you with the things that you need, the things that make you feel fulfilled. Who makes you feel safe? Consider those people. Consider the one who consider they're being surrounded by friends or family or just your partner. How do they make you feel? Do they lower anxiety? Do they make you feel like you're at peace? Do you feel like you still have control? If they make you feel overwhelmed, that's probably not the best choice and selection of a person that you need there. And then find out what roles do you need them to play. If you have other siblings, then do you need someone to help watch the baby while you are at the hospital or birth center, um, or at home? You got to consider all of that if that's something that you're looking to do. So consider the ones that make you feel calm, the ones that make you feel supported, and that's who you can have to surround you. Your birth partner is going to be somebody who helps you through your labor and your birth. They should be a calm and comforting, positive presence, and they don't have to be a spouse or the baby's biological parent. So consider hiring a professional birth partner, and a professional birth partner is a doula. A doula is a professional birth assistant who is known and knowledgeable about the process and the physiology of birth. They have the tools for coping with labor and ways to support families through pregnancy, birth, and postpartum. Doulas have proven many benefits. They've proven to lessen the rates of pain, medication, cesarean, and instrumental delivery, shorter, less complicated labors, increased breastfeeding success. Doulas do not place the medical provider's role or perform medical tasks. When I say instrumental delivery, I am referring to things like forceps, vacuums, and things like that to try to help um, your baby through delivery if there's some type of complication. Other people that you might consider having a birth photographer present or a videographer. If that's a moment that you want to capture, you're free to do that. You may need to hire someone to be a sibling care. There are specified doulas that are actually sibling doulas, and they actually help with the babies, the kids that are previously getting them settled, getting them adjusted to the new baby to the family. They actually have doulas to help with that. So you could consider having sibling care. You may want a family member or a close friend available for you. Think about this. Do you want a student or a residency student, someone who's in the hospital that's doing an internship? Do you want them to be involved or come inside of your room to help? Those are things that you got to think about and consider. Then ask yourself, who makes you feel safe? What are some times that you felt respected and nurtured? If you've given birth before, is there anyone you want or you don't want to be with you again? And do you feel more peaceful surrounded by supportive people or with the least amount of people possible? And here are a couple questions that you can ask your provider. How do you like to interact with extra support people at birth? Then take a little pause, look at them, give them the opportunity to answer. If they seem a little leery, they may not have a patient centered approach. Do you have any limits, rules for support people and who may be at my birth? That is very important. If you are one who's going to need more support than average, you may want your baby, the kids, the siblings to be involved and be there during the birth. You may want your mother or a best friend or your husband or your partner to be with you. It's your choice, but you got to figure out what do you want and what do you need when it comes to the support that you have around you. And that would really help you a lot to figure out the type of provider that you're looking for. And what experiences have you had in the past with doulas? What is your opinion of a doula? When you're asking them about what a doula does, what their opinion is about a doula, and if they have anything negative to say or seem a little bit leery about having a doula, then I would probably not consider having them, because doulas are, they believe in having, providing evidence-based material and giving you what you need to empower you to be able to go and ask the questions that you need to ask your physician. And there are, unfortunately, some out there who really don't like to be questioned about the things that they do in their practices, and that's okay. It just isn't okay for you. So you have to consider that when you are choosing a provider. And you know your partner best. So encourage them to be intentional when choosing their birth team. So think about what you need, think about the support that you need, and then try to be intentional when you're choosing a birth team. I wish you the best of luck, and I hope that you glean from this resource and take the time to write down some notes and some questions to ask. If you would like for me to send you a handout for the different types of providers that you can interview, it's just a handout of questions that you could use. Please give me an shoot me an email at serenityandhopedoula@gmail.com, and let me know if you need notes for an obstetrician, question notes for that, or question notes for choosing a midwife. So let me know what you need. Send me an email at serenityandhopedoula.com, and I will gladly send you a worksheet to help you be able to ask questions and fill them out so that you can make a sound decision when it comes to who you want to be your provider and how you'll build your birth team. Best of luck to you.